The term addiction has been replaced with the broader, less stigmatizing term substance use disorder. The term drug abuse has also been replaced with substance abuse or substance misuse. What then are the substances to which we refer? The following training will cover some definitions and classifications that will help us understand what exactly the substances in substance use disorder are. We will discuss classifications according to various effects on the brain and body, legal classes, and medical diagnostic criteria. We will go on to learn about the basic classes of substances and some of the more common substances that lead to disordered use, or what used to be called addiction. The information contained in the following training has been accessed and verified as of February 2023. Statistics shown here represent the most recently published data from the National Survey on Drug Use and Health, published in 2021. Additional sources include the DEA, CDC, WHO, and the Office of the U.S. Surgeon General. Please see a list of references at the end of the presentation for more information. The content of this training module is not intended to be comprehensive or diagnostic in any way. If you're experiencing symptoms of tolerance or dependence on any substance, contact us at 833-367-4689 for help. In the following module, we'll discuss the definitions of terms, including substance. We'll explore what makes a substance psychoactive, what differentiates drugs from substances, and respective forms of misuse. We will also consider a spectrum of usage behaviors that sheds light on what constitutes high-risk use and ultimately addiction, or what we now refer to as substance use disorder. Much of the confusion about the term substance use is that substances are such a broad classification of stuff. The term generally refers to any kind of matter or material. If this matter has been artificially manipulated, purified, combined, or altered, it's referred to as a chemical. The term drug broadly includes medications and other substances that have physiological or psychoactive effects when introduced to the body. The World Health Organization defines psychoactive drugs as those that, when introduced into the body, have effects on perception, consciousness, cognition, mood, emotions, and other mental processes. Psychoactive drugs are not all necessarily illicit or dependence-producing. In fact, many medications administered by physicians have the intended effect of altering mental processes. When talking about substance use, it's generally assumed that the substance or drug involved is psychoactive in nature, and the term psychoactive is thus left out of most discussions. In the context of substance use disorder, the Surgeon General's report on alcohol, drugs, and health defines a substance as a psychoactive compound with the potential to cause health and social problems, including substance use disorder. Substances discussed in the report include alcohol, illicit drugs, prescription-type medications used for non-medical purposes, over-the-counter drugs, and other substances such as inhalants. In contrast, a drug can be defined as either a medication or a non-medically used psychoactive substance. One of the main reasons we have stopped using the word drugs in reference to addictive behavior is because of this ambiguity. The stigma of the term drug may create a barrier to people accessing medically required psychoactive medications. A similar distinction is required between substance abuse and drug abuse. Substance abuse is a broad term that refers to the use of any substance, illegal drugs, prescription drugs, over-the-counter drugs, or alcohol, in excessive amounts. Many of these addictive substances are fine in small amounts, especially if they're used for preventing or treating health issues. Drug abuse refers to the use of drugs only, not alcohol, illegal drugs, prescription drugs, or over-the-counter drugs, in excessive amounts. However, the American Psychiatric Association and the World Health Organization no longer use the term drug abuse as a medical diagnosis. It's important for us to make these distinctions because the reality is that multiple substances are utilized for different reasons, including medical purposes, personal recreation, religious ceremonies, social cohesiveness, and to cope with mental distress. We thus can view substance use on a spectrum ranging from complete abstinence through to addiction. We should also note that factors such as sex, age, weight, underlying health conditions, and pre-existing risk factors will affect where one falls on the spectrum. There are also cases in which there is no beneficial use for a substance, such as for young children or during pregnancy. Non-use refers to total abstinence from a particular drug or from psychoactive substances altogether. Beneficial use refers to instances of substance use that may have positive health, spiritual, or social effects. This might include marijuana use for pain management, hallucinogen use for ceremonial purposes, or alcohol consumption at a celebratory event. Lower risk use is that which bears little to no risk on a person or the people around them. Higher risk use refers to the pattern of substance consumption that negatively impacts a person and their environment. For example, alcohol use may be considered high risk if it involves impaired driving, putting oneself and others in danger. The most extreme and detrimental level of use is addiction, or substance use disorder. This occurs when a person develops a compulsive use, tolerance, and dependence on a substance. A key indicator that somebody has reached substance use disorder is that they are unable to stop using despite wanting to.